Hi, everyone. It's Sachin with the Living Proof Institute. And today we have Dr. Jared Seigler, who is also from the Living Proof Institute, from our Cincinnati office. Jared is our clinical director, and he's got a super special interest in children's brain health and raising the next generation of superhumans, if you will. So Jared, thank you so much for joining me today. I know you're super busy. Both of us were running just a couple of minutes behind because you were finishing up with a client, and I actually had a patient that came in from New York. Her and her son came in, and so I was just chatting with them before they went into their consultation. So thanks for being here. I appreciate you taking the time out of your day to share all this amazing knowledge you have.
Oh, thanks for having me. And, you know, we both agree, to me, this is extremely important knowledge because, you know, the less a child's brain can develop, the faster it's going to generate earlier in life. And we can see that now. Just it's kind of this wave that's coming. So from a standpoint of how can we make a huge impact and try to prevent all this heartache and pain, let's just get a hold of it like right now when these children are young, you know, versus when they're older.
Yeah, it makes a lot of sense from that perspective. The pharmaceutical companies are trying to get to these kids sooner.
Yeah.
Us holistic, more altruistic practitioners, if you will, need to start getting to these kids sooner before the proverbial boogeyman comes and snatches their health away from them.
Yeah, and a lot of things are on the parents. Not on them in a negative way, but there's a lot of things that parents can do, and that's really what I was wanting to focus on today is what are just some strategic things that we might consider basic that can have an extremely good impact. Because, you know, the goal that I have is to try to keep kids off of those medications because just a single dose can permanently change the way their brain is wired. And there's kind of no going back sometimes after that. So I'd rather definitely stop it. You know, as most people know, it was a struggle for my wife to get pregnant. She was actually my first patient trying to figure out how to get pregnant. And then once we did get pregnant, it was kind of like, okay, well, now what? Because a little bit more about both of us have autoimmunity to the nervous system. So to me, that was a big thing I wanted to do is make sure my daughter didn't necessarily have to suffer, be given these labels. And how can we just try to keep something from happening too? Yeah, so.
Well, that makes a lot of sense. You know, obviously you have a deep ingrained passion. So maybe just because there's going to be a lot of new people watching this who may not know your story, why don't we dig into that a little bit more? Just if you could spend a couple minutes on it so it gives people context.
Yeah, you know, I learned about functional medicine from you. As you know, I was going to start seeing all the traditional chiropractic patients and working with the athletes. And then I told you my wife was diagnosed with PCOS. She didn't have her cycle for over 5 years. And one night you just told me fix the gut. So we ran the first stool test I'd ever run, ever. And I saw these parasites, and I remember Googling, trying to figure out, like, man, I've never even seen these before. But then after we started to kill them, she had her first cycle in 2 months. And so it was a relatively fast process. And that's when I really started to realize her body wasn't making a mistake. Nobody's body is making a mistake. It's just doing everything it can in the environment that it's in. It just has an extremely different set of priorities than maybe we consciously have. And then, so when she got pregnant, that's when I really wanted to make sure that we were more proactive than reactive. Because with autoimmunity, we know there's that genetic susceptibility, but there has to be a lot of triggers. And I keep talking about that just because that's kind of near and dear to my heart. But what we're finding is that's increasing in numbers. So if these kids are typically given these kind of alphabet soup like Pandas or autistic spectrum disorder, for the vast majority of them, there's typically an autoimmune component going on. The brain is a very target-rich environment for the immune system, so to speak. There's a lot of enzymes, there's a lot of different proteins, so it can kind of get bombarded. So when my wife was pregnant, we wanted to start focusing on eating the right things because food truly is going to be like one of the best things parents can do. And, you know, we have this little one-pager we were going to give people after this. But if I had to choose one thing any parent could do, I would say pack your kids' lunches and increase the quality of the food that they're eating. that organic sticker means so much more than people know, especially with things like the glyphosate. What's being sprayed on our food supply is illegal in most of the rest of the world. I want that to sink in kind of for a second. So what other countries have outlawed to feed people, we spray on foods we give to our kid. It's in their formulas. It's in everything.
Well,
so I would, oh,
even
go
if you
ahead.
don't care, even if you don't care about your kids, it's sprayed on our food too, right? As adults. So if you're
Yeah.
watching this and you don't have kids, or if you're trying to get pregnant, let's say down the road, which many people, especially if you're women, you have to take this into consideration. These chemicals basically store themselves in your tissues. And so they also compromise your immune health and biodiversity of the gut microbiome. So yeah, I didn't mean to interrupt you there, but I think
No.
it's people have to realize the
Yeah.
magnitude of the problem.
So it basically trashes the gut. It provokes the immune system. I say it kind of just keeps poking at it. It keeps our good bacteria from even utilizing basic minerals, so we can't build energy and antioxidants, but they poison mitochondria, which is big because for us, when we have a mitochondrial issue, we typically we lose what's called duration of task. We just can't think for a long time. But in kids, usually a lack of energy is actually them bouncing around from subject to subject. Usually the first sign of any mitochondrial issue is fatigue. And these chemicals can damage that stuff. So what we have are genes that are progressively getting a little bit worse and a little bit worse with each generation, just because, like you're saying, it's everywhere. It's in all the cord blood. Even if a woman's eaten organic and tried to live in kind of a chemical bubble, it's not happening. So now we have more genetically predisposed children in the worst environment. And we know environment is really what drives a lot of these things. So when we tell someone to eat organic, it's not sprayed with all of that crap. I'd rather, when trying to nurture children's health, I don't like to try to micromanage it. I'd rather just pour less fuel on a fire than try to add more fire extinguishers and just let nature run its course. But other than that, balancing blood sugars can be an extremely big thing. Like, a child shouldn't just eat Pop-Tarts for breakfast, even if they're organic Pop-Tarts. There's not a lot of good fuel for the body to kind of run off that. And I tell people, think of like blood sugar kind of like the backbone for everything else. That's how you're going to build your hormones, how your liver is going to detoxify, how your brain's going to work, how the immune system functions. Everything requires energy. So stable blood sugars is stable energy production. And usually if they get too high, they're going to get too low. That pendulum really just starts swinging. So when they get low blood sugar, that's when they get more anxious and they get more kind of out of control, because they're going to have all these stress hormones just kind of like coursing through their veins at this point. So if I wanted a kid to not pay attention, I would feed them an extremely carbohydrate-rich diet, especially simple carbs, like a Pop-Tart again. And I would just try to make them sit there under blue light and see how long that could happen. And I'd make a game about it. I'd guess about 20 seconds is about the max, even an adult maybe being able to sit there in a situation like that. And so then we can kind of see that happening, because if a child is having trouble focusing, we have to start to kind of extrapolate and wonder, are other parts of the brain maybe not able to work with memory and cognition and learning? If there's not memory to just pay attention, what else, or energy, if there's not energy to just pay attention, what else is there not energy enough to do?
Well, energy is a systemic problem, right? It's not localized to the brain, and it might manifest, initially as seemingly a neurological issue, because the nervous system requires so much energy to operate. But there's a global problem, really. So if their brain is not functioning optimally, well, neither are their kidneys, neither is their digestive system, neither is their immune system, because every system in our body requires energy. The brain tends to prioritize based on its weight and mitochondrial density, but it's impacting every system.
No, absolutely. And that's where I kind of disagree with the medication standpoint, especially being the first line intervention, because basically we give a child slow release methamphetamines. That's like what Adderall is. And then we force the brain to do something it's not really well equipped to do. And now they become dependent on it, because that same process where they couldn't make energy is still occurring. Like, and everyone's like, oh, my kid does good on meth. And I'm like, yeah, most people probably are very productive on methamphetamines. But that doesn't mean in the long term it's doing us any favors, you know. And there's stories like, there's stories that was made in World War II for Germany. Nazis are the ones that really started it. They just doped up their army, and they were seeing things and shooting at stuff that's not there. It's really rather insane what happened. Or we'll maybe give them like selective norepinephrine reuptake inhibitors, or what's called SNRIs, because norepinephrine is what gives this a kick in the pants to go. And that's usually where we see a lot of dopamine issues with children as well. A lot of the motivation, their cognition, their mood kind of goes out the window. And then we can start to sometimes see a lot of impulsive type behaviors too. You know, there's a lot of different kinds of ADD and ADHD. There's subsets of categories, but, you know, it's alphabet soup really. But then we can kind of, we can actually measure some of those things through urine and actually see like how's the conversion of dopamine to norepinephrine and things like that. Like where actually is this process occurring? Like kind of back to the blood sugars, one of the best ways for a child to maintain regular dopamine levels and an adult is to just stabilize blood sugars. Because every time that blood sugar gets low, dopamine is now being converted to adrenaline and noradrenaline. And usually the part of the brain that controls the stress response the most is the one that gets damaged the most by the stress response. So it's just kind of this feed forward mechanism. So the worse it gets, the worse they get. So
just for listeners who may not know the names of these neurotransmitters and their pathways, what are some of the symptoms of, let's say, you know, a person with compromised dopamine? I mean, I know, but just for people who are, what type of behaviors might they see in their children? What type of consequences might this have? And and maybe we can relate it back to the chemistry from there.
Yeah, dopamine issues can sometimes manifest as like obviously concentration and focus, but defiance, inability to control emotions, because dopamine works on the part of the brain that stops not just activities, but also like behaviors. So now kids are hitting, kids are doing things they don't really have necessarily control over. And we actually have to realize when a kid says like, I couldn't do that, it's important for a parent to understand they probably literally couldn't stop themselves. The part of their brain maybe that says, don't hit Janice or whoever the classmate is, it tells them that, but the brakes aren't strong enough, so they actually still hit that person maybe. And dopamine's kind of, again, depleted with stress, so usually they don't do good under stress. The more we stress them out, kind of the worse it gets, which is extremely unfortunate. So that can be a sign of dopamine imbalances. Usually on the high end of the spectrum, we see things like schizophrenia and those types of diseases. And then when there's a lack of production or utilization, like the end result is, or the worst case scenario is typically like a type of Parkinson's type disease. So those are kind of the ones people are most familiar with.
And
but if
dopamine isn't just an issue for children, right? We'll see people with dopamine-related issues having unnecessary anger.
Addictions are big too.
Addictions. Yeah.
Yeah. Everyone wants to just surge dopamine, and that's where maybe kids get addicted to foods, which can be huge. Like talking about exomorphins, and I made a little video people can watch a little bit more, but these kids become addicted to this food, and that can be a huge, huge problem. They're eating a food that's like a fuel for a fire, and the end result is their brain doesn't work too well. But then they kind of surge that dopamine, and then there's kind of this loss. So, and then as adults, we typically see people get addicted to other stuff. And usually what we see is people try to boil it down. So, well, I quit drinking. So now maybe I just exercise like 10 hours a day. You know, so they're still addicted to something. It's just not, it's socially more acceptable to run on a treadmill for hours and hours and hours than it is to start drinking at noon. So, you know. But
it depends on where you live too, right?
Yeah, maybe, right? If I go back home to Ireland, then I'd be like the outcast that's not getting drunk at noon. No, I'm kidding.
They'd be like, look at that guy out there. He's addicted. He's got a problem.
Yeah, exactly. You know, but then we see kids getting addicted to a lot of other stuff too. And usually for them, it comes in the form of foods and activities too. So then as they develop later in life, we want to make sure that those repetitive types of behaviors don't keep going and going and going. You know, one of the first things we see, especially depending on the severity of where we see maybe the brain is having trouble working and communicating or developing, a lot of the first things we want to do are look for primitive reflexes to start to go away. Eventually that rooting reflex and that palmar grasp, all these types of reflexes that are hardwired kind of back here in the nervous system, as this starts to develop, those should start to go away. So then sometimes we might see things like bedwetting issues. We might see things like anxiety issues if they're stuck in kind of this constant fight or flight state. Maybe they didn't learn how to have their nervous system turn that part off. And now these kids are anxious all the time and they're scared all the time. And kind of back to that autoimmunity, that's when we have to maybe view, like when I'm working with a child with Pandas and I was explaining to the mom, we have to view the emotional outbursts as an autoimmune disease because that's what Pandas is. It's not, in this case, a neurotransmitter issue. The brain can make him, we actually looked, his brain can make these neurotransmitters. It's just the signaling is off. And that's due to autoimmunity. So we have to, if we're going to help with the signaling, we have to help with the immune system not attack a certain part of his brain. And that's the part of his brain that controls a lot of the emotion center, like what's called the limbic center of the brain. And now there can be things like a lot of fears and anxieties. Anger can also go to, anger, as you know, is a derivative of fear. So when somebody says something mean, they're usually actually afraid. So always remember that. But kind of back to the reason why someone might want to pack a lunch for their child. Schools don't offer organic food, but they put aluminum in that spray as well. And aluminum is what's called bioaccumulative, meaning it stays in the system. And hopefully they have changed the criteria, but I was reading in the New England Journal of Medicine back in 1997, the types of formulas they use for the preemie babies. On average, they were getting about 50 micrograms of aluminum per kilogram of body weight a day. And after 10 days of being on that feeding tube, they would notice severe cognitive decline in those children later in life.
Wow. And
so
just on that topic, Crystal Doherty has a question, and she says that I was surprised, since it's on the same topic, I was surprised to learn that IFM believes in vaccines considering the known toxins in them. What are your thoughts on the potential for buildup of the toxins, especially for those with methylation issues and the impact on brain health? So you're just kind of going on that. So I thought
and that's where we see that increased genetic susceptibility, like MTHFR, COMT. We know a big predisposition to somebody having an adverse reaction to something like a vaccination is going to be matrix metalloproteinase, which is kind of how the immune system responds and acts to heavy metals, but also a lot of those autoimmune genes, those HLA-DQ ones. So just for the record, me and my wife have autoimmunity, so my daughter's never been vaccinated, and she never will be, because those things are a huge problem. There's actually a lot of good research talking about how whenever somebody cites a study saying aluminum is safe in a vaccine, what they're comparing that is a study where they had rats eat aluminum, and it's not even the same kind of aluminum that we inject under the skin. So we're in effect comparing apples to baseball bats.
It's science, B.
Yeah, basically. And there was another study they did where they injected I think it was 1,200 micrograms of aluminum in rats. It was a crazy high number. They didn't find it in the urine or the stool, and they couldn't find it in the blood. So then they said, I guess it's not a problem. And I'm like, you injected that much aluminum into something and you can't find it. It's definitely a problem. So what happens with something like aluminum in the vaccines is they're bioaccumulative, they stick around, and they really offend the immune system. That's the reason why they add it to it, is if I'm going to give you a dead flu cell wall, well, I can make the immune system hate it even more if I throw aluminum in there too. So, and that's part of back to those MMP, those matrix metalloproteinase types of genes and those autoimmune genes. They can't do it. And then like with MTHFR, now they can't methylate these metals to pull them out. So and then they just stick around and they stick around, and they activate the immune system in the brain called glial cells. And that's what's going to really, really, really keep the brain from developing to its full potential. It's kind of like if I broke into your home, you're not going to worry about fixing dinner and things like that. Now it's, I'm destructive, I'm destroying stuff, I'm stealing stuff, and now all the kind of what the body's after is now getting rid of that invader. It's just poorly equipped to do it in these genetically susceptible children. I don't want to talk about IFM because they're not here to defend themselves or anything, but I can't agree with a statement like that. But I've seen well-known neurologists just say something blanket statement like, oh, just spread them out. And I'm like, yeah, because taking aluminum at different times can be so much better. But it's a big political thing because there was this one research, it's actually a book called Vaccines, Adjuvants, and Autoimmunity. And there's a lot of immunologists that contributed to that. Not one of them was from America. So it's a big pariah thing because if you say anything about it, you're just going to be kind of blacklisted. No hospitals are going to hire you. Everyone's going to call you a quack. When in reality, there's just no research to support that they've actually done their job.
Yeah, and I think that doctors in general, whether they be chiropractors, naturopaths, medical doctors, are at this constant war of approval of their peers and their communities and their patients. And they're afraid of what people are going to say when they say something controversial. But I like yourself, I'm more afraid of what people are going to say when I knew all along and didn't say anything.
Yeah, like if you're a mom and you have like rheumatoid arthritis something and watching this, if you're the first time you've ever heard autoimmunity is a big risk factor for vaccine damage, if that saves one kid from potentially getting something very terrible, I'm all for that. And it's not like they get it. It was because we're told these kids are sick whenever it's a vaccine damage. They're not sick. That's what it is. They're damaged. They got hurt. So it's not their fault. But to me, yeah, I can't sleep at night knowing that stuff's going on. I'm actually part of an email chain of a bunch of nerdy doctors. I think I've told you, I can't add other doctors to it because then I get kicked out. But most of them are MDs from all over the world, a lot of PhDs, a lot of them at some very notable teaching schools, like teaching hospitals. And people start bringing up the subject of aluminum. And I am super glad that basically everyone in that group is like, oh, it's a terrible idea. Like, I'll never inject aluminum in anybody I care about. It's just the problem is the kids that typically need it the least are the ones that get it the most. So if they're preemie, if they're already having all these things, well, oh, your kid has these issues. Let's make sure we vaccinate them with hepatitis B. Like, really?
No, you never know where they wander off to, right? What goes on in the incubators.
Yeah, exactly, right? Yeah, they can't even get out of that. And that's kind of another thing too. Back to the incubators, touch is huge. We were designed to be touch. Sensory input leads to motor output for the brain. So like whenever we see something and we're trying to get maybe parts of the brain to develop, like I'll see children that are born without parts of their brain, and we're trying to help with sensory input to just try to get something to connect as much as possible to help with things like being able to control the diaphragm and the spine. So that way we're not more prone to like head injuries and needing breathing treatments and things like that. Go ahead.
Why don't we do this? I just wanted to acknowledge people who are tuned in. For those of you that are tuning in, we're covering children's brain health. We're talking about developmental concerns, observations that parents might be able to make about their children. We got into vaccines and aluminums because we had a question come in about them. I did want to acknowledge that Seigler has joined us, Keishan has joined us, Christine, Ken, Robin, Horner, Gretchen, thanks for joining in. Shauna, Kathy, Tracy, Melissa, Elisa, all the way from the UK, and Bina has joined us. We've got quite a few people tuned in, so I just wanted to acknowledge all of you. If you could show some love for Dr. Jared, that'd be great.
So, no, thanks for watching. Yeah.
Go ahead. We had a question come in from Sila, so I just wanted to acknowledge that as well.
Yeah.
He's coming in late, but did you cover vaccine exemptions and any info of potential changes that is now allowed? I would love for you to speak on Pandas here in Pittsburgh. So she's inviting you to speak at a little event that she's got going on there. And it's
nice.
Already a decent size, and sadly it's growing. Hi, Dr. Jared and Dr. Patel. Hope you're both well. Thanks, Sheila. It's great to hear from you. It's
Hey, Sila. Yeah, autism kind of gets a lot of the limelight because it's, I guess, more of a, I don't want to even say trendy thing. The problem is it's becoming trendy because it's becoming so common. But Pandas is 10 times more common than autism. And it's just after.
Can you define Pandas for parents that might not know?
Yeah, so then they develop autoimmunity to the psychiatric part of the brain or emotion part of the brain, typically after strep infection. So
what
then
does Pandas stand for?
Oh, geez. See, now I hate the acronyms.
Okay, well, if you don't know, that's fine.
I know the etiology, and there's different subsets. There's like PANS, so then maybe there's not like a autoimmune component to a certain degree.
We need to come up with something that sounds nastier than a panda, because when I think
I know it's like a fluffy sounding disease, but it's like one of the most debilitating. So it starts with, we have the basal ganglia and certain receptors fire up and certain ones fire over. Which autoimmunity do they have receptors to? And that's where some of them do terrible on some of these medications. They're like, oh yeah, I gave it to my kid. He flipped out like 10 times more than he normally does. We're like, okay, it's these receptor sites then. But so then we have that autoimmune component. What happens is strep will start to live typically in the back of the throat. It infects the adenoids and things like that. And there's a thing called strep M protein. That protein has a lot of molecular mimicry to a lot of those dopamine, those D1, D2 receptor sites. And so that's where I say we have to view those emotional outbursts as an autoimmune component. And then we just kind of have to see it. Like we see strep maybe in a stool test. We see it in the history. They went on strep, round of antibiotics. Now they freak out. And the parents tell me it's like a light switch turned on, and now my kid's not my kid anymore.
So for clarity, is it the strep itself that triggers the response, or is it the treatment for strep?
The strep itself. So yeah, because it's due to and that's where kind of like with the vaccines, kind of back to that can be a big thing because, for certain people, they just get sick and they get over it. For people with autoimmune genes, that infection might have been the straw that broke the camel's back, and now we have that molecular mimicry occurring. So for these children, we have to get rid of the strep. It can still be subclinical and still living in the adenoids, even if we don't maybe have like those big white spots on the back of the throat that we look for. And so that's where you can measure antibodies. There's a thing called the Cunningham panel that specifically looks at it. I'm talking with another lab called Vibrant America. They have what's called a neurozoomer, where now they're looking at more antibodies to the nervous tissue. Like I said, it's a target-rich environment because now we're seeing kids with pandas that we're thinking they might have autoimmunity to serotonin receptor sites now. And different parts of like how the brain sends. So we build neurotransmitters in kind of the axon, and we got, or the actual like body of the cell, and we have to send that neurotransmitter down to the end sometimes. And those little kind of tubes can be attacked as well. So then it's just figuring out like what's being attacked where and why.
So not everyone who has strep will develop this problem. Is it at a certain developmental stage of the brain? Is there certain predisposing factors that make somebody more susceptible to this? Is there a way to screen our children so that we're maybe taking proactive measures against strep? And for those of you that don't know this, you can actually use cilantro oil to kill strep. So, even I'm just thinking, if we know that a child is susceptible to pandas, if there's a way to identify that, I mean, are there any, first of all, is there a way to identify the predisposition? Secondly, I would certainly suggest cilantro as a big part of the diet because that pulls out heavy metals as well.
Yeah. I can't know about more like a predictive because the antibodies won't be there until after the thing already kind of happens. And that's where you just want to look at that history too, kind of that autoimmune component. Does mom or dad have autoimmunity?
Is it more common in somebody who's been vaccinated versus somebody who's unvaccinated?
Absolutely. Yeah, and that's where the antibiotics, they might have a good positive where we kill the strep, but we know that in the gut, the bacteria really teach our immune system on what's called like tolerance. How much is the immune system willing to take? The good news is there's a thing called central tolerance that's made by the thymus. Me and you don't have it, but a small child still does. The thymus is kind of goes through this checks and balance system of, here's brain tissue. This is what it's supposed to look like. Don't attack that. So there's a thought process that maybe a kid with autoimmunity doesn't have to maintain autoimmunity the rest of their life. As long as that thymus is still there, maybe we can try to reprogram that central tolerance. So not saying we can cure autoimmune diseases, like, you know, that's a very bold statement to make. But, you know, we start to wonder, like, do we have to kind of be stuck with the cards we're dealt with? Genetically, we know that's maybe not the case. We can do things like fasting while a mother is pregnant to change MTHFR genes, at least in rats and mooses and cats and things like that. We can see it. I don't know many pregnant women that are willing to go 3 days without eating to try to get rid of an MTHFR gene variant. So we're kind of off topic, yeah, but I would say that's where you want to really have the gut be healthy, creating a lot of that immune tolerance, teaching the immune system what to attack, what not to attack, kind of let a sleeping dog lie. Because if we're maybe eating, you know, and I know Seila's not feeding her kids a bad diet or anything, but if a child's eating a poor diet, they're, you know, bombarded with all these heavy metals, which really start to have the immune system kind of shift its balance a whole lot. And that's just going to set that predisposition up where now the odds of it happening are more likely. Like, you know, hint, hint, my daughter got measles. It was a 2-day rash. Like, that's what measles is. You know, maybe 4 days if their immune system's still learning. But, you know, kids are always going to get runny noses and things like that. It's just, can the immune system get over it? So, and that's where, like, those strep antibodies, you know, maybe in the wrong person, they could lead to cardiac issues, renal issues. That's why, you know, a kid, maybe the antibiotics aren't the best thing for them, but trying to look for a kidney is pretty tough too. So, you know, kind of pick your poison. There's never going to be a perfect answer, I don't think. And that's where really just looking at the risks and benefits of seeing what's going on. It's not like, and it's not like there's really like a vaccine for that or anything. So we can't really blame that. It's not going to correlate one way or the other. But the metals, whew, definitely the metals.
Okay, so we've kind of discussed, and we can keep going about, you know, the problem and you know, how messed up our society is and how clueless parents are in many cases about, you know, food, about what they're injecting into their children. And it's not that they're clueless, they're just miseducated. So they don't even know they're clueless about these topics because they're delegating this responsibility to a trusted authority who is their practitioner, who themselves is delegating their ability to think to another body, who is then that body delegates what actually happens to patients to, you know, the big pharma or health, you know, whoever runs this healthcare mafia that we have, you know. So we're not even getting the right information from the right sources, and so it could be pretty difficult for a lot of people to grasp. So we'll just leave it at that for now. But what can people who are watching this do? So let's assume you don't have a vaccine damaged child, you don't have a child that has pandas, you don't have somebody who's got a complex health issue. Certainly we can help those people, but how do we optimize a child?
Glad you asked. Yeah, so the biggest thing is, balancing the blood sugars. That's where I try to go in and talk to schools about quality of food, things like that. But, you know, packing it, eat the organic food, pay the extra. It has to be 100%. I think circadian rhythm is huge. Avoiding blue light, especially after a certain point, is going to be like extremely important for these kids to get a good quality of sleep. My daughter's brain needs like 11 hours of sleep as opposed to I run pretty good off of about 7.5. So as you know, I get up at 5 and I'm like done after that, like ready to go. So we avoid a lot of blue lights, and I put, and we can follow up with people. There's apps that you can use, like iPhones, things like, hey, you don't want them playing on it, but if they're going to be on it, at least like have a lack of blue light, because that's going to excite the nervous system. And then it's going to be extremely hard for them to shut off at night. And the way the brain works is if I can't recharge my batteries at night, I'm just going to spend less energy during the day. So then it's kind of this big, big problem. When I actually used to work with athletes, I didn't care about their exercise volume before a meet. I cared about how good they're sleeping, because that tells me how good can they recover and heal. So sleep is one of those things that it's like it has to happen. Usually these kids have an altered sleep-wake cycle. Maybe they're taking like a Adderall or something during the day, so they're stimulating them. But that pineal gland and a thing called the suprachiasmatic nucleus, fancy words for what regulates that sleep-wake cycle, it gets confused by all the blue light. So if we're watching something, or a kid's watching something at 8:30 at night with blue light, that light hitting the back of their eye tells their brain it's high noon, why even bother falling asleep? So, and it's excitatory. So when I work with teachers, I say, cut off the lights in your classroom. And then they say things like, oh, Timmy didn't get a headache, Ryan's not hitting people, and Erica stopped her ADD medication, all from not getting too much light. Crazy. So I think that's going to be, you can't mimic, because we have clock genes. Our body works on the environment. So if we start messing with our environment and this genetic expression, of course we're going to have something be a problem.
And here's the thing: we want to recognize that it's actually not a problem; it's an undesired result. So what's happening is something that will always happen, right? So it happens. If it happens in one person, it's going to happen in another person, because this is a biological response to a stimulus. We don't like what the stimulus means. It means we can't go to bed at night, but there's nothing wrong with your body, right?
Yeah.
The problem isn't your body in this scenario, or any in most cases, the body is responding to the stimulus that is being delivered to it. And so we got to change that stimulus. And even in some cases, patients might need to reframe the language, right? The problem isn't the body. The problem is the stimulus to the body. The body is responding the exact way it's supposed to. It always has, and it always will.
Yeah, exactly. So that's where we try to focus on what I call foundational things. Like when I see a lot of patients, a lot of them are like, well, I want my kids to do good too. So I say, let's start doing these basics. Let's make sure everything's on the up and up, because that stuff has to start happening anyways. We can give kids pills and stuff to help their sleep quality improve through feedback loops and things like that, but nothing's going to be better than just doing it naturally. Always the supplements are reserved for something that a child can't eat their way out of, or something like that.
Right.
And speaking of like trying to do lifestyle stuff, having a kid play is extremely important. I don't care what they do, but they have to breathe hard every day. That can't be mimicked, especially with the effect that it has on energy production, hormones, neurotransmitters, like everything positive benefits from exercise. And these kids have way more than enough energy anyways. Hopefully their mitochondria are still on the par and they're like ready to go. Like people that watch my daughter are just like, she doesn't stop. She's not like other kids. Like she just keeps playing and playing and playing. But so I say, just make sure they breathe hard. That's all. As a parent, that's all you have to do. Just play tag, play chase, do whatever. If they're involved in a sport, make sure they do that. When they get to the point the intensity is high enough where they've actually started to change their brain physiology, and all for the better. So it's not like these kids have adrenal fatigue at 6 years old, so we don't have to worry about them getting overtraining syndrome or something like that. But they actually increase hormone levels to increase connections in the brain. They make certain types of chemical signals with nitric oxide that protect neurons now. They're going to balance blood sugars better. It's going to make them tired. When I worked in a lumber yard, that's when I slept the best, is when I was physically exhausted, because nothing's going to make you tired more than manual labor. But they actually, it helps with opioid release, not in a bad way where these kids are like addicted to stuff, but that's kind of those exomorphins they get addicted to, maybe corn, rice, wheat, and then dairy are big ones. But with the opioid release, that modulates the immune response. So like any patient with, or any parent with maybe autoimmunity that takes something like LDN or low dose naltrexone, they know how much they love that, because it kind of stimulates the opioids, and now the immune system's just kind of like so much more stable. So it does that, but then it's going to increase the number of mitochondria that they make, and it's going to make the and it's going to also, the mitochondria they have, make them work better. Because
I think that a lot of parents are challenged with and struggle with is sleep for their children. Either the children have broken sleep or they don't want to go to sleep. And so two things that I want people to really take away from this that you can control immediately, right, is light exposure, because that affects the circadian biology. We talked about the suprachiasmatic nucleus and how that's involved, and the pineal gland. But the other thing too is if your kids can't sleep at night, maybe they're not active enough during the day. So getting them outside, or horsing around with them, getting them to play instead of sitting so much, because they're already doing that, and we know that physical activity is becoming less and less during of a priority in school systems. That this is these two things can be very important in getting them to sleep better. And when they sleep better, they heal better, and their brain heals better. And obviously there's tremendous amounts of benefits of getting solid amounts of sleep. So I think those are two really, really easy things that people can do to help improve the sleep in their home.
Yeah.
Themselves. Like here's the thing: a child's brain is I consider a little bit more precious, because we still have influence over it, and it's not fully developed. The brain remains plastic for a lifetime. So we can, these things will also benefit adults, right? Because some of the things that we're describing, some of the symptoms that we're describing, things like anger, an inability to control rage, the depression, anxiety, these are problems that are rampant in adults, but we're scared now because we're seeing these problems develop in children, right? But it's the same essential biology that's creating it. It's the toxins, it's the deficiencies, it's the light exposure,
yeah,
physical activity. There's all these elements that when you do this for your child, you're essentially doing it for yourself and your
yeah. Well, mindset's big for these kids too. Like they found on MRIs, when the brain develops under stress, the part of the brain that controls stress is very plastic. So these kids have a more heightened stress system, so to speak, than most of their adults. Because as the brain is developing, the way I say it is, the brain's just kind of like, well, this is my life, this is reality, I better get used to being stressed all the time. So we actually focus a lot on parents doing like gratitude and mindset and relaxation with their children. We have to teach the brain to be plastic to learn how to relax too. And that's where these kids have a hard time turning that system off. They're constantly in that fight or flight mode. And
parents have to demonstrate these things, right? The first language is your child actually seeing you and watching you. I mean, that's before they can speak, before they can understand the words that are coming out of your mouth, is they're watching the way you're behaving. So my wife and I had a drastic change in our lifestyle, and the words that we use, the language that we use. I mean, we were pretty good, but we were unconsciously good. And then we became consciously really good at, these components, because we understand how important the first 7 years of a child's life is. And we can't tell our children to do something unless we're actually doing it ourselves. And of course, the beautiful thing about those recommendations is they benefit the adult as well. Whatever your child is missing, you're missing as well, right? That's the thing that I hope gets across. I mean, your children aren't watching this, obviously, but if you're watching at home, you're watching this, and these things will benefit you as well. So if you don't care about your kids, which I know all of you do, you can at least do this for yourself and see the global benefits in somebody's health. We had a couple questions come in. I want to make sure we answer them.
Yeah.
One is Tracy. She's asking, is the clean 15 okay? Or is it important to be organic in everything that you eat? Because you did mention that.
I would say organic in everything. Everything we buy is organic, just because, I know what that stuff does.
Yeah. So I did an interview, which it will be released in the fall, with Anthony Swa, and he is somebody who came, he's part of photojournalist for National Geographic. And when he moved, he came from overseas, and he moved to the US on an assignment to study the great, market crash in 2008. And when he came here, he started discovering all this buzz and hype about glyphosate and Roundup and, pesticides and things like that were being used. And this whole organic movement kind of took off around that time. And so he's been studying that. And, he's talking about, there's a lot of things I can't say because it'll ruin the interview, but there's some crazy stuff that's going on that we need to become hyper conscious of as parents and even as adults. I mean, even if you don't have kids, this applies to you. Tracy is also asking, is a child that's been vaccinated up to age 5 and shows no current symptoms, what can one do to detox them out? They won't be getting any more now that she is informed.
Don't do any aggressive chelation therapies. That's like this terrible terrible thing. I'm in that, well, not terrible all the time. Like maybe if I played with a mercury thermometer and there was a massive acute exposure, IV chelation might be good at that time. That's where really we look at things like the glutathione, the antioxidant system. We look at the sulfation, we look at methylation. We see, can the body actually clear a lot of these things out? And usually what has to happen is you have to get it out of the cell to get it into the blood to get it filtered by the liver. Because a lot of these metals are actually too big for the kidneys to filter out. So that's where they kind of get stuck, and we don't see a lot of it pass through the urine. So I like to do low and slow for those things. Like I got the anthrax shots in the military, which have an extremely high amount of aluminum. So I just told my wife I'm just going to take glutathione support, and like silica is really good for helping with aluminum neurotoxicity. Like I'll just take that for a decade because I can't actually measure how much is in my brain.
Without a biopsy, right?
Yeah, exactly. And the less holes in my head, the better. So I'll take that. Yeah, but that's where just being proactive. There's some things in the diet like smart binders, like cilantro, coriander, chives, things like that. Those can be good into the diet to be very passive, because typically you'll see that with a lot of these kids. And that's good that they didn't notice anything, but the brain does take a hit. It's just the brain has to take enough of a hit where we actually notice. So
it's hard to like split test a child, right? To know what a non-vaccinated child with the exact same microbiome and genetics would be. So I'm glad like at the surface, everything is great, but you know, they could be at that tipping point, right? So they could be closer to that point where a child who's not vaccinated, and this isn't to scare anyone or anything like that, but just keep in mind that if your child seems fine, that's fantastic and we're happy for you, but that doesn't mean they're not just this far away from their bucket overflowing. So there could be some emotional stress that puts them over the edge. There could be a traumatic event, a divorce, like there could be a bunch of things that, that overload that allostatic system. And then they just, they succumb to whatever consequences might be as a result of that.
Yeah. And that's where predictive antibodies can be good too, because most people think of the brain when they think of vaccine damage. When I think of the words vaccine damage, my first thought is autoimmune diseases in general. And that's a giant umbrella. Like kids with autism, over 80% of them have antibodies to myelin basic protein. So we know there's a huge autoimmune component with that population of children. So that's where you can look at maybe like predictive antibodies. We can kind of see these things coming. So we've seen antibodies for cardiac tissue in children, for lupus antibodies in children, even though they're asymptomatic. And that's where kind of back to that central tolerance. Just because they have these antibodies, it's showing they might be moving in that direction, but they don't necessarily have to end up at that direction. So to me, being proactive and kind of knowing is more important than being reactive, especially when we're talking about the health of children.
Yeah, no, I totally agree. So just as we kind of wrap up, it's almost 1 o'clock. What are, you know, if somebody feels like they're doing a lot, they're eating healthy, their kids are outside playing, they're avoiding tablets and cell phones, they feel like their home environment is a stable place, you know, what are some of the next steps? Like, you know, of course, if somebody has a more significant challenge that they're facing with their child and they want to do something about it, how can people learn more about what it is that you do and get in contact with you?
Well, I mean, Facebook's always good. And that's where I personally, before I work with any kid on the spectrum, I tell the parents they have to be gluten-free and dairy-free, because there's good research that about 90% of them get better just doing that. Not better like it goes away, but better. And I just tell them we're going to have to modify the diet. And if we can't remove the biggest offenders in the diet, they're just not going to get better. It's really, I don't want to say it's that cut and dry, but we want to have realistic expectations. So barring that, parents are doing the right thing. And I say that's where the testing shines. If we're already eating organic and avoiding blue light and doing already a lot of those things, the testing isn't designed to replicate replacing the lifestyle. We really try to focus on that already being there.
Right.
But then we can actually find out that minutia, like which toxic chemical are we talking about? How are the cells actually working? What is happening with the gut? We can get even fancier and do more testing where we look at immune function and antibodies and things like that. But usually I just like to start with peeling the layer, or peeling that onion just one layer at a time. Like I've never seen a normal first stool test, especially with someone extremely symptomatic.
Yeah, I think another important thing to mention to parents is, when we think of health, we think of state, right? As adults, we think of how do I feel right now? When you think of your children, you want to think of trajectory, because they can't, especially if they don't know any different, they can't fully express what is pain and what is not pain, what is brain fog and what isn't brain fog. They just don't know any different. Like a child, if you don't test to see if a child needs glasses, they're going to assume that it's normal to see blurry all the time, right? Or they're going to assume that they can only see this far until you show them a whole different, unless you put a lens in front of them and they start to see, no, I should be able to see much further than that. So a lot of this is thinking about trajectory. What direction is your child's brain going in? And is it heading in the same trajectory as what you envision them to be able to do with their life, right? So think about that. So as an adult, you think of state. As a parent, you want to think of trajectory. And even if your child seems perfectly fine, like we get our son tested, I know Adeline's had some testing done because we want to identify these problems way earlier rather than later. Mind is a beautiful thing. And if we can if we can play our part in protecting it as parents, then that's the most important asset your child has, is their brain health and neurological development. But the cool thing about this whole process is that we get global benefits, not just transient or isolated benefits to the brain. The entire body benefits when you get it working the way it's supposed to.
Yeah, well, because the gut, immune, and nervous system are like a three-legged stool, and that's where we can kind of see what might be contributing to it. Do they always have a runny nose, or are they always bloated, or are they gassy? Hint, hint, if your child complains of a headache, that's a sign they need to stop whatever neurologically they're doing. If they're trying to do math and they have a headache, that's their brain telling them to stop. So don't force it to go overtime. Let them actually have a break. And I never kind of understood homework. You spend 8 hours a day at school and you got to come home and do more. Like, what do these kids have, like 12-hour jobs learning how to learn the alphabet? Get out of here.
Conditioning them to be slaves and not questioning when they have to bring homework home with them.
Well, in the United States, what drove a lot of public schooling was actually the need for factory workers. Can someone read and regurgitate information to perform a task? That was it.
Without questioning authority.
Yeah, exactly. And we know all the good entrepreneurs do terrible in school because they don't fit that pattern of just sit there, be a good monkey, and, put the round hole in the round peg or round peg in the round hole type thing. I don't want that future for my daughter by any stretch of the imagination.
Well, awesome, dude. Thank you so much for sharing. So if you need to get a hold of Jared, you can feel free to message him. He's hyperlinked in this post. And then if you feel like you need to dig a little bit deeper, then he can, help you out there and help you make those next steps to having your child or yourself come in and work in a doctor-patient capacity with him. Because obviously you can tell there's a lot of vast knowledge that he has, and this is just the tip of the iceberg. So if you want to dive deeper into this, if you want your children to live the best possible life, then that's what I love about our office. I'm going to give us a little shameless plug here. I love the fact that you don't have to be sick to work with us, because our focus is to get you as healthy as possible, not to just get you back to feeling quote unquote normal. Normal is actually not that great. If you look at the average person these days and where their health sits compared to where their potential is, it's quite alarming. And most people don't know because they don't know what their full potential is because they've never lived it.
It's more alarming too that our kids are sicker than we are. So it's extremely common.
Scary stuff. So thanks again, brother, for your passion. Thanks for everything that you're doing. And thanks for sharing your knowledge with us. And for those of you that don't know this, Dr. Jared is also a practitioner coach. So he actually trains about 100 practitioners on how to, take all this information, make sense of it, and then create effective protocols so that our practitioners that we coach can also have an impact in their community. So if you're looking for somebody locally, we can also pair you up with somebody close to you if you're not in the Cincinnati area, or we can work with you remotely as well. So the beautiful thing about technology is we can work with really anyone from anywhere in the world. So it's great to be able to offer that to people that need it.
Well, thanks for having me.
All right, brother. Well, enjoy the rest of your day, and we will talk soon.
All right, talk to you later. Bye.